Hey everyone, Dr. John here. Today, we're talking about a topic that's close to my heart, literally. We're diving deep into the world of heart attacks. Now, I know what you're thinking. Dr. John, heart attacks sound scary. And you know what? You're right, they can be. But knowledge is power, folks. Imagine your heart is like a house. It needs a constant supply of electricity to keep the lights on, right? Well, your heart needs blood flow to function properly. A heart attack happens when that blood flow gets disrupted, kind of like a power outage in your house. But instead of the lights going out, it's your heart that's in trouble. This blockage is usually caused by a buildup of plaque in your arteries, those important highways that carry blood to your heart. Over time, this plaque can harden and narrow the arteries, making it tough for blood to get through. And when that happens, bam, heart attack. But don't worry, we're going to break it all down in a way that's easy to understand. So buckle up and let's get heart smart. Okay, so we know that a heart attack happens when blood flow to the heart is blocked. But what's actually going on in there? Picture your arteries like pipes that carry blood to your heart. Now, imagine those pipes getting clogged with gunk. That's kind of what happens during a heart attack. This gunk is actually called plaque, and it's made up of things like cholesterol, fat, and calcium. Over time, this plaque can build up inside your arteries, making them narrower and stiffer. It's like trying to squeeze a large pizza through a small doggy door. Not gonna happen. When this plaque buildup becomes severe enough, it can completely block the flow of blood to your heart muscle. And when that happens, the affected part of your heart doesn't get the oxygen and nutrients it needs to function properly. This can damage the heart muscle, and if the blockage isn't treated quickly, it can even lead to heart failure. Now that we understand what causes a heart attack, let's talk about how to recognize the warning signs. Remember, time is muscle when it comes to heart attacks. The sooner you recognize the symptoms and seek help, the better your chances of a positive outcome. So, what should you be on the lookout for? Chest pain is a big one. It might feel like a tightness, pressure, or squeezing sensation in your chest. You might also experience pain that radiates to your arms, back, neck, jaw, or stomach. Shortness of breath is another common symptom. You might feel like you can't catch your breath, even if you're not exerting yourself. You might also experience nausea, vomiting, lightheadedness, or a cold sweat. Section 4. Don't be a hero. Seeking help when it matters most. Listen up, folks. If you experience any of the symptoms we just talked about, don't wait around hoping they'll magically disappear. Call 911 immediately. I know it can be scary, but trust me, it's better to be safe than sorry. Remember, the faster you get medical attention, the better your chances of limiting any damage to your heart. So, don't try to tough it out or downplay your symptoms. And please don't try to drive yourself to the hospital. That's what ambulances are for. Section 5. Your heart's best friend. MyHomeDoc Telehealth, affordable and convenient care. Now I know what you're thinking. Dr. Oz, all this talk about heart attacks has me stressing out. And you know what? Stress is never good for your heart. That's why I want to tell you about a convenient and affordable way to stay on top of your heart health. MyHomeDoc Telehealth. With MyHomeDoc Telehealth, you can connect with a board-certified doctor right from the comfort of your own home. They can answer your questions, provide personalized advice, and even help you manage your heart health. Remember, your heart is in your hands. So, make healthy choices, listen to your body, and don't hesitate to reach out to your doctor if you have any concerns. And for affordable and convenient healthcare, check out MyHomeDoc Telehealth. Stay heart healthy, everyone.